Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we try to enlighten members of the public on trending health issues from around the world. Today we are looking at an essential part of health care known as the oral care. It is often overlooked. We are more specific today. We are looking at mouth diseases and care in children. The conversation begins after this break. Please stay tuned.
You hold me, you keep me safe, you are my world. Not every baby gets this chance.
Every 7 seconds, a mother or baby is lost to causes we could prevent. Not enough midwives, not enough medicine, not enough time. But this can change when we invest in science, in strong health systems, in equality, when we make the choice to support mothers and babies, when birthdays are moments of hope, not loss. We protect the future, because every healthy beginning means a hopeful future for us all.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Oluwatobi Olusesi, pediatric dentist, and she is going to tell us what exactly are mouth diseases and how to care for children. Dr. Olusesi, thanks for finding time to join us on the show.
Evening, everyone listening. I'm glad to be here this evening.
Oral health is an essential part of our well-being, but oftentimes it is overlooked. Why is this so?
The reason why diseases of the mouth are important is because most times we overlook it. The mouth is a very important part of the body that we need to care for, but most times we often neglect it. And also, the mouth is like the gateway to every part of the body. So whatever goes into our mouth is a reflection of our general body.
How early should mothers introduce oral care? Oftentimes we hear most people share an opinion that infants and toddlers do not necessarily need oral care. How true is this?
Most times we neglect the fact that, okay, let me break it down this way. We have two teeth in our mouth throughout our lifetime. We have the primary dentition and the permanent dentition. So the primary dentition is usually the first teeth that erupt into the mouth from, let's say, 4 to 6 months of age to about 6, 7, or 8 years before we shed that out and our permanent dentition starts to erupt into our mouth. So the primary teeth should not be neglected, because however we take care of our primary teeth can affect what our permanent dentition would look like. So as soon as the first tooth starts to erupt into the mouth, we need to start taking care of it. Even before then, as soon as you give birth to the child, you start to clean the child's mouth with, let's say, wet washcloth, something clean. So immediately after eating, you want to clean the child's gum with a wet cloth. And as soon as the first tooth erupts into the mouth, you want to start using toothbrush. It's very soft toothbrush to clean for the child.
Share with us what exactly are these diseases of the mouth?
So in our mouth, we have a lot of other structures. The mouth houses the teeth, the gum, the tongue, the lips, the palate. So the most common disease of the mouth is dental caries, that is tooth decay. So tooth decay is like a multifactorial bacterial disease that affects the teeth and can cause damage to the teeth. It is usually caused by an interplay of 4 factors, which is the bacteria itself, and the time factor, the diet, that's the intake of fermentable carbohydrates, and also the time, the tooth surface, bacteria. When we don't take good care of our mouth. These diseases can occur in the mouth. And how do we prevent this? It's by taking good care of our mouth by brushing twice daily, eating proper diet, by flossing in between the teeth, because the toothbrush can't go in between the teeth. So you want to use like a dental floss, which is like a rope, to clean in between the teeth.
Apart from dental caries, what are the other diseases?
Some patients can present with infections like viral infections that affect the mouth, bacterial infections like hepatic gingival stomatitis, which is a viral infection that is common in children below the age of 6 years. So these children present to the clinic with fever, with blisters and ulcers in their mouth. But since it is a viral infection, it can usually subside. It resolves on its own. So we only take care of symptoms. Also, there are other conditions that affect the mouth that are not primarily infectious diseases, like malocclusion, which is as a result of habits in children like thumb sucking habits, tongue thrusting, or lip sucking habits. We also have oral cancer. There are a lot of conditions that can affect the mouth and every structure that is present in the mouth.
How do you handle tooth loss? Oftentimes, infants and toddlers migrate from their milk teeth to the normal teeth. How do you handle this so it does not result into other oral health conditions?
The primary dentition starts to erupt into the mouth from 4 to 6 months of age to about 6 to 8 years of age, when the permanent dentition starts to erupt into the mouth. And it is a normal physiology for us to shed out the primary teeth for the permanent to erupt into space. So there's nothing to worry about. As soon as the primary dentition starts to exfoliate, you just want to continue your basic oral hygiene tips by brushing twice daily, caring for your teeth, flossing, avoiding intake of refined carbohydrates, and just basically taking care of your mouth. So there's nothing to worry about. Once your primary tooth falls out, your permanent would most likely erupt into that space. However, there are some situations whereby the permanent dentition does not easily erupt into the space due to a lot of factors. Like I also mentioned earlier, that sometimes you have malocclusion when the teeth are not well aligned into the mouth, which can also be caused by a lot of factors. So for these children, sometimes they need to present to the dental clinic for us to examine, for us to do further investigation and know what treatments the child may need for us to bring the dentition into the space in the mouth.
Children also experience the inability to swallow fluid and the likes. It is also known as mouth ulcer. What are the home remedies mothers can introduce before checking in with a specialist?
Okay, so at home, we want to try warm saline mouthwash. That is salt and water. And how do you do this? You want to boil water to a normal and allow it to cool down to a normal temperature the child can tolerate. Then you add like a teaspoon of salt into the glass cup of water, and you allow the child to put into the mouth. The child can gargle also, and you hold it into your mouth for some time before you spit it out. So you can do that several times in a day. You can also give vitamin C or paracetamol if the child has symptoms of fever or other infections present in the mouth, just to boost their immunity.
Another oral condition experienced by children, people generally, is known as halitosis, also called mouth odor. How do you check this at an early stage? When should mothers or people experiencing this should be worried?
So halitosis is also a very broad aspect of oral health. So halitosis is basically mouth odor, which can be caused by a lot of factors. It can be caused by local factors, that is things that are present in the mouth that can lead to halitosis, or systemic factors. So for oral factors, if you have poor oral hygiene, it is normal for you to have mouth odor. And another thing is most times we brush our teeth and ignore our tongue. It is very important for us to always clean our tongue because most times bacteria stick to the tongue surface if we don't clean properly. So other conditions that can cause halitosis are diabetes, gastro reflux disease also. Sometimes when you have that kind of disease, you can have halitosis. Also, though not in children, for adults, sometimes smoking can also lead to halitosis. So when a child has halitosis, you want to bring the child to the clinic for us to do a proper investigation and find out the cause of the halitosis, because the treatment is not really in the treatment per se. You want to find out the cause of the halitosis. If you're able to find out the cause and you'll be able to treat that way, because there's no really treatment if you cannot pin out the main cause of the halitosis.
The World Health Organization says the African region has the highest number of normal cases in children. What exactly is this normal cases, and how do you quickly address that?
Yes. Okay, that's also like a bacterial infection that is usually caused by, it is common in, I think, the northern part of Nigeria. It is usually caused by bacteria, and when you are malnourished, when you don't take in proper diets, it is common among the poor communities, and it is very easy to treat also if you can figure it out on time. I think the medication, the bacterial medication that is used costs less than 5,000 naira. I'm not very sure about this, but it's something that is very easy for you to treat. It's a bacterial disease.
The World Health Organization says only 17% of the population in Africa have access to essential dental care. Is it that dental care is not affordable, and how do you encourage the public to access this vital aspect of healthcare?
Okay, I'm not going to say dental care is not affordable. It is very, very affordable. And if we think about it, our mouth is very important for us, because it's not just for eating. We use our mouth for a lot of things. We use it to speak, to express emotions, and a lot of things. If our mouth is not healthy, it's like the overall well-being is faulty. So it is important for us. It is just twice in a year, just 2 times. You can just devise a meal. Maybe you do you plan ahead for it. That maybe, okay, January I want to go see my dentist. Then also by June I'll go for my second visit. So you can it is very affordable. And when you are visiting the dentist, it's not like the dentist is going to cause you any pain or anything. It's just for you to do like a routine checkup. And if you need to clean your teeth, you want to do that also. So it is dental treatment is very affordable. And when you are coming to the dentist, you are not coming there necessarily for you to treat anything. We're just going to do like a routine checkup for you to know if there's anything going on, because all these diseases we are talking about, it is very important for us to pick them early. It is the pain and the more expense comes in when you don't present early enough to the dental clinic.
Earlier in your response, you advise mothers to embrace or use soft cloth for oral care in infants and toddlers. What are the necessary composition of a toothpaste? We hear that fluoride is not fit medically. How true is this? Can you clarify this?
It is very important for your toothpaste to contain fluoride, because fluoride helps to prevent dental caries. So we usually recommend for your toothpaste to contain fluoride. However, for children below the age of 6 years, there has to be fluoride in the toothpaste, though in a lower concentration.
Okay.
Not to brush, but the toothpaste still has to contain fluoride. It is very important because it prevents you from having tooth decay.
As we wrap up now, what do you like the public to know or improve on when we talk about dental care?
Oral health is very important because if anything is wrong with your mouth, it's going to affect your general well-being. And it is very easy for you to take care of your mouth. Just requires you to brush twice in a day, but in the morning and last thing at night. Then you also want to floss at least once in a day. That is cleaning in between your teeth. Also, don't forget to brush your tongue whenever you brush. Then also, you want to, most times, dental caries is caused by diet, by kind of diet you take, by snacking on refined sugar. So you want to substitute refined carbohydrates for fruits and vegetables. Also, you want to avoid smoking habits, intake of alcohol. Yeah.
All right, oral care remains vital. It forms a major part of health care for human beings. You need to pay particular attention to your oral care. Dr. Oluwatobi Olusesi, pediatric dentist, thank you so much for your time and expertise on sound health.
Yeah, thank you for having me.
I have been speaking with Dr. Oluwatobi Olusesi, pediatric dentist, on mouth disease and care in children. Sound Health continues with trending health reports from around the world. Please stay tuned. Mouth diseases in children require adequate attention to prevent the pains that come with it. Remember, you need to brush twice daily and seek medical help early enough. This is where we say thank you on today's episode of Sound Health. If you have topics you'd like us to treat or you have comments about previous episodes, please send SMS to 00358 to 6603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.